Eye color is not a personality trait, a talent marker, or a hidden performance advantage. It is a melanin pattern in the iris, and that pattern changes how your eye filters light, how much glare you tolerate, and, at the margins, how risk is distributed across a few eye conditions. So when you analyze the advantages and disadvantages of eye color, stop using beauty language and start using light management language. Your iris is part of an optical control system, and the real question is not whether one color is better, but how much pigment you have, what environment you live in, and whether you manage the trade-offs intelligently. Here is the mechanism. Eye color is largely determined by the amount and distribution of melanin in the front layers of the iris, under genetic control involving multiple genes rather than one simple dominant versus recessive story. More melanin usually means darker brown eyes. Less melanin usually means blue, grey, green, or lighter hazel eyes. That pigment is not just cosmetic. It changes how much incoming light is absorbed, reflected, and scattered before visual information reaches deeper structures. That is why the most honest medical way to frame eye color is this. Darker irises generally provide more natural light filtering, while lighter irises generally provide less. That does not make light eyes defective or dark eyes superior. It means each comes with a different optical starting point, and your job is to manage that starting point the way you would manage any other biological setting. Now get specific. The clearest disadvantage of lighter eyes is usually greater light sensitivity in bright environments. People with lighter irises often report more discomfort in sunlight, fluorescent lighting, or reflected glare because they have less pigmentation in several layers of the eye to help block harsh light. That extra glare load matters because it does not stay confined to the eye. It can increase squinting, visual fatigue, headaches, and attention drain, which means the nervous system spends more of the day compensating. There is also a risk stratification issue. Major cancer and eye organizations list light-colored eyes as a risk factor for uveal or intraocular melanoma, which is rare overall but medically serious. So the practical downside of lighter eyes is not vanity. It is a combination of lower glare tolerance for some people and a slightly less favorable risk profile for certain pigment-related eye conditions. The advantage of lighter eyes is mostly that there is no universal visual penalty attached to them. Many people with blue, green, or hazel eyes function perfectly well. They just need tighter light hygiene. Darker eyes have the opposite pattern. More melanin often means better comfort in bright conditions, less glare sensitivity for many people, and a little more natural buffering against intense ambient light. In real life, that can mean less squinting outdoors, less fatigue under strong sunlight, and fewer situations where brightness alone becomes the problem. But darker pigment is not armor. Everyone's eyes are vulnerable to ultraviolet damage, and the AAO is explicit that UV can damage the cornea and lens and contribute to cataracts and other eye conditions, regardless of pigmentation. There is also an important nuance people miss. Some older observational research has found that very dark brown irises were associated with higher rates of nuclear cataract and cataract surgery, possibly because the same pigment that absorbs light may also absorb more solar energy. That does not mean dark eyes are a cataract sentence. It means the trade-off is not as simple as more pigment equals total protection. This is why most people misunderstand eye color. They look for binary answers when the physiology is about exposure, tolerance, and cumulative load. Your eye color does not decide whether you will see well, age well, or tolerate screens well. Your total environment does. Sleep quality affects dry eye symptoms and visual comfort. Screen behavior affects blink rate and eye strain. Outdoor habits affect UV exposure. Recovery state affects how irritable your visual system feels under bright light. The endocrine and autonomic systems show up here indirectly because stress, migraines, and poor sleep lower your tolerance for bright environments and make normal glare feel much more hostile. So the strategic reasoning is simple. Eye colour is a modifier, not a destiny. You do not treat it like an identity. You treat it like a risk adjustment variable inside a bigger visual system. Now apply it like a coach. If you have lighter eyes and bright outdoor light reliably makes you squint, tear up, or lose focus, your response is not to toughen up. Your response is to reduce glare load early. Use sunglasses that block UV. Use a brimmed hat when exposure is strong. And do not wait until your eyes are already overloaded. If indoor fluorescent light gives you trouble, change the environment before you blame your eyes. Reduce overhead glare, position screens to avoid reflections, and stop using maximum screen brightness as your baseline. If you work on screens for long stretches, use the 20-20-20 rule and deliberately interrupt near focus before fatigue hardens into headache and blur. If you have darker eyes, do not make the opposite mistake and assume you are naturally protected enough to ignore sunlight. You still need UV protection because darker pigmentation lowers some discomfort but does not make the cornea and lens immune to sun damage. If your environment is bright, both eye colours need protection. Lighter eyes just usually need it sooner and more consistently. Here's where most people stop. But here's the advanced layer. You do not judge your eye colour by appearance. You judge it by operational tolerance. Track what actually happens to you at noon sunlight, under office LEDs, after 5 hours of screen work, after poor sleep, and during high glare driving. Watch for downstream markers, more headaches, more squinting, slower visual recovery after bright exposure, late-day eye fatigue, and whether you're using brightness or darkness as a crutch instead of as a tool. Personalization matters here. A light-eyed person with migraines may need much stricter glare control than another light-eyed person with no headache history. A dark-eyed person who spends all day outdoors may still need aggressive UV habits despite feeling comfortable. And if you notice a new change in iris color, adult-onset heterochromia, or a sudden shift in light sensitivity, do not self-diagnose. The AAO advises that new heterochromia or changing iris appearance should be examined because eye color can change from benign causes or from conditions that need treatment. Build your routine around repeatable rules. If you know bright light overwhelms you, your morning setup should already include your glasses, not a decision. If you know your eyes dry out and your tolerance collapses during screen-heavy days, blink on purpose, break on schedule, and keep glare lower before symptoms accumulate. If you drive at sunrise, on water, on snow, or around reflective concrete, prepare for the environment rather than reacting to it late. If you have a family history of eye disease, or you are reaching the age where silent eye problems become more common, stop waiting for symptoms and get examined. The AAO recommends a baseline eye disease screening at age 40 for adults without known risk factors, and the NEI emphasizes that dilated eye exams are the best way to catch many eye diseases early, before vision loss shows up. That is the compliance piece. The smartest eye color strategy is not cosmetic, it is preventative. And one more correction, because people are now trying to hack eye color instead of understanding it. Unapproved eye color changing drops and cosmetic eye color changing procedures are not performance upgrades. Ophthalmology groups warn that these products are unproven, not FDA approved, and potentially dangerous. And the AAO has warned that cosmetic eye color procedures can damage vision. So do not chase a different iris color as if it will solve glare, improve appearance enough to justify risk, or change who you are biologically. The real advantage is knowing your setting and training around it. Light eyes, tighter glare control, tighter UV discipline, earlier symptom management. Dark eyes, don't confuse comfort with invincibility, and don't skip protection because you feel fine. That is the whole frame. The detail worth replaying is this. The advantage or disadvantage is rarely the colour itself. It is the behaviour the colour should trigger, and whether you act on that early enough for the rest of your visual system to stay quiet.